Hello guys, so andito na tayo sa exfoliative cytology. So this portion now of our histopathology focuses on how we handle the the smears that comes into our laboratory. So for the topics for today, so you have an overview kung anong i-expect nyo today. So the definition of exfoliative cytology, how is it used, what is its purpose, syempre, so that we could appreciate it, the protocols or steps on how we perform it, Papanicolaou stain, so this is very important stain for exfoliative cytology and vaginal hormonal cytology. Sorry, men. So, hindi natin matatanggi na usually the cells that are usually tested in the laboratory are pap smears. Yan, from a pap smear test. So, napaka-affordable kasi nito, napaka-accessible, and it's very reliable. So, pag-aralan natin siya ngayon. So, exfoliative cytology class, it studies the cells that have been desquamated. Yan, desquamated, they are sloughed off or removed from the epithelial surface. Okay, so this is not like biopsy. So wherein we get a portion of the tissue sample. This is the cells that has been removed. Yan. So usually guys, we get the cells through swab, ganyan, or through a spatula, or through a brush. Yan. So we get a little bit of a sample. So andun sa sample na yun, merong cells. Yan. And we stain it. So guys, this is an example of pap staining from your cervico-vaginal smear. Cervico-vaginal smears. Yan. So, ito makikita niyo yung different types of cells. And so far guys, lahat ng cells dito normal ha. So, we have superficial squamous cell. So, isn't it that class ang vagina? It has stratified squamous cell. Ibig sabihin, magkakapatong na squamous cell. Aside from that, we have parabasal cells and navicular cells. So class, yung mga cells ng vagina, class nagbabago based on the hormones of the woman. Yan. It's very heavily influenced by the hormone. So yan, we are studying the desquamated, the removed, the sloughed off cells from our tissue surfaces. Yan. So, hindi kailangan tanggalin, scrape off, or so on. Yan. So, class, dahil dito, class, we could assess malignant and cancerous conditions. So, pinaka-usual specimen nga dito is your vaginal smears, pero we could use other specimen. Also, yan, it could test sterility, endocrine disorders, because nga your cells are influenced by your hormones, your sex hormones, progesterone, estrogen, detect an asymptomatic cancer. Yan. So, class, the changes in the cell, yan, could be related to cancer. So, if there are changes, so maganda kung regular na pinapagawa. So, kung na-observe na there are changes in the cells, yan, it could point to cancer or precancerous cervical lesions, yan, may sugat-sugat, determination of genetic sex, and determination for possible infection. So guys, how important is pap smear, especially sa mga ladies natin? So when you are already 21 to 29 years old, magpa-test ka na every 3 years. Pag 30 to 64, you have pap smear every 3 years, HPV testing every 5 years. So, ang rami kasing sakit na sa cervico-vaginal area, cancer, yan, endometrial cancer, endocervical cancer, depende sa part. So, it's a preventive healthcare routine. Yan. So, guys, affordable siya. Okay? So, mas mura magpa-pap smear kaysa magpa-chemo. So, mas maganda, ina-detect na siya earlier. It's important to be tested if not sexually active. Can detect HPV. So, HPV, Yan, if you are sexually active naman dito, if you have multiple partners, because HPV could cause cervical cancer, and yun. Yan, so you have, so as much as possible, kailangan magpa-pap smear. Ako hindi ko pa na-try magpa-pap smear. That's on my to-do list. So specimen for examinations, guys. So vaginal smear, endometrial and endocervical smear. So class, endocervical, so nasa cervix area, medyo nasa baba pa. Endometrial nasa uterus, okay? So nasa uterus area. So class, kunyari may abnormality sa endocervical smear, edi yung cancer or yung lesion nasa may cervix. Kung sa endometrial, nasa uterus, okay? Prostatic and breast secretions, gastric and bronchial, pleural, peritoneal, sputum, urine sediments, and CSF. Pero hindi masyado CSF. So what are the steps for exfoliative cytology? So specimen should be fixed immediately. So most common class is 95% ethanol. The best is 95% ethanol and ether. However, class, flammable itong mga to. Okay? So class, ito naman. Yan, mamagulo mo. Most common, sabi mo, 95% ethanol. Ito naman, may 50%, 70%, 95%. Yes. Sabi sa notes eh. So class, it's okay to use 50% alcohol. Yun nga kasi nga masyadong flammable tong mga to. To your effusions, mga peritoneal, pleural, vaginal. 70% alcohol for sputum. You could use, ano na yun class? Yung fixative for sputum, gendris, if I'm not mistaken. We have 95% alcohol for gastric secretions and urine sediments. Also, class, as a preservative, yan, Saccomano fixative or preservative, 50% ethanol and 2% carbowax. This is interesting because there is carbowax component. So class, if there is enough volume, you could subject it to cytocentrifugation because the sediments are the most important part. So class, notice this cytocentrifuge. Ito yung nasa loob. Class, ang liliit ng lalagyan. Yan. So class, this machine is especially, it could be used specifically for our cytologic specimen. Kung konti yung volume. Pero sometimes, class, yung mga pleural effusion, it could be 1 liter, ganun, maraming ml rin minsan. So, precautions during fixation. So, first is identify your slides. Don't forget about that. But however, you could print it out or you could use your pens. Use paper clips to the identified end of the slide before preparing your smear. So, class, sa Pilipinas, yun. Paper clips or yung mga alligator clips, yung black na ginagamit natin. So, yun, so that you would know the end of the slide. Just a guide. Landmark, kumbaga, smear should be placed into the fixative container immediately after preparation, yes, to maintain the optimal form of the cells. Place each smear in fixative by a single uninterrupted motion to avoid rippling of the smear. So, single, uninterrupted. So, pagkapasok mo, itaas mo agad. Yun. Avoid rippling of the smeared material. Avoid striking the bottom of the fixative container. Yan. So, don't strike. Wag mo iaabot. Wag mo itatama sa bottom of this container to prevent dislodging of the cells. So class, sometimes some of your specimen, class, needs a little help. It needs to adhere yan, to the slides. So class, it just needs a little glue. Kumbaga. So yung urinary sediments at saka yung mga bronchial aspirate lavage. Tama ba ako? Bronchial aspirate lavage. BAL. Bronchoalveolar lavage. Yan. Aspirate. So, in cases daw, if you want to rule out pneumocystis carinii or Girovechi, kung may example, may AIDS yung pasyente, common to sa USA, yung fungal pneumonia that is caused by a fungi, yun nga, pneumocystis carinii or Girovechi. So, yan, bronchial alveolar lavage daw. If you want to identify if it's caused by a bacteria, by COVID, by fungi. So, kailangan ng urinary sediments, BAL, at saka specimen which utilize proteolytic enzymes. They need adhesives. What type of adhesives? Pooled human serum, pwedeng maging adhesive, guys. Celoidine, yung natin, infiltration reagent. Celoidine ether alcohol and leuconostoc culture, bacterial culture class. So, pwedeng gawing adhesives. Ma'am, ba't hindi pwedeng gamitin yung egg albumin? It's not recommended because it will produce a background stain. Yan. Kung naglagay ka na ng EA50, yung EA50 class kasi it has a component which is light green SF, special formulation. So, itong EA50, meron siyang component na light green SF. So, class, it could stain your egg albumin. Yan. So, serum, human serum, yes. Celoidine ether alcohol, and a culture, bacterial culture, could be used as an adhesive. So, class, there are different ways to prepare your smear. So now, you have adhesives, you have already fixed it, you prepared it, and now we're ready to stain it. And the most common stain, the routine stain for exfoliative cytology is pap staining. And so for cervico-vaginal smears nga, so there is a speculum, yan, you open yung vagina. Tapos the OB will get a swab or using the air spatula, yung yellow na yan. So, they will, sa lateral third area of the vagina mamaya, upper lateral third area of the vagina, doon kukuha ng specimen. Yan. So why stain it with pap stain? Yan. So, it has excellent nuclear detail. Yan, kasi gumagamit ng Harris hematoxylin, transparent blue staining. Tingnan niyo yung cytoplasm. Ganda. Color range is predictable and great value in identification and classification. It is good in comparing cellular appearances. So, it has three main stains. Yan. Itong light green SF, it's part of EA50 or EA36. Yan. So, itong Harris hematoxylin gas, it's used for nuclear staining. Ito yung mga main na stain. OG6 at saka EA50, these are counter stains or your cytoplasmic stain. So, dalawa yung cytoplasmic stain. So, yung OG6 ang galing, class. So, it usually stains, may pagka-orange Orange, red to pink. Yan. So, it could stain pang-acidophilic It stains the mature cytoplasm or superficial cells with red. Yan, red to orange. Yan, yung OG6 stain. Ang galing niya. So, itong stain na to, yung cytoplasm is tinistain niya ng pink, yung mature. Itong EA50, guys, it stains your cytoplasm of the immature cells. Yan. So, example of immature cells are your intermediate and parabasal cells. So, ayan. So, class, it has, may contents ang EA50. May iusin Y, birthmark brown, and light green SF. So those are the components of your pop staining. Huwag kakalimutan, okay? Galing, no? So yung EA50, pang intermediate or parabasal cell and parabasal cells, itong OG6, superficial cells. So ang labas niya is about pinkish, yan, acidophilic. Itong cytoplasm niya, greenish. Parang kumbaga turquoise. So, pop staining protocol. So, first step, ayan, una i-dip muna sa 95% alcohol, tapos 70% alcohol. Yan. So, ano yan? Ascending or descending? Diba? Descending grade of alcohol. So, guys, kayo, dapat alam niyo na, descending grade of alcohol, ano? Is it for dehydration or for hydration? Yan, hindi ko na sinulat. Dapat alam niyo na yan. Descending grade. Next, guys, Harris hematoxylin. Harris hematoxylin for nuclear staining. Acid alcohol. Anong purpose ng acid alcohol? Parang sa HNE. Ano, differentiator. Ammonia water, or kung di man ammonia water, scat stop water for bluing agent for making the nuclear stain blue and permanent. So ito, next is ascending grade of alcohol naman. Yan, for dehydration. OG6, staining the cytoplasm of mature cells. 95% washing and dehydrating. Cytoplasmic stain for immature ang EA36 or EA50. So washing and dehydration ulit. And clearing. Kailangan lagi ng clearing. Yan. And you're ready to mount and label. Okay? So these are the results, class, of your pop staining. Yan. So ito yung kinulayan ng OG6. Tapos ito yung kinulayan ng EA50 or EA36. Ang galing, no, guys? So the nucleus are blue. So guys, sa mga squamous cells, pycnotic nucleus, ang liliit. Yan. Ang liliit. Cytoplasm, pink kung superficial, green-gray kung mga intermediate cells, blue kung parabasal cells. Mamaya, malalaman natin. Superficial cells are pink. Intermediate, greenish. Parabasal, bluish eh. Candida albicans, red. Mamaya, I'll show you a picture. Trichomonas, pear-shaped and gray-green. Yan. So, ito yung mga Candida albicans, hyphae. Yan. Di ba fungi siya? Candida albicans. So, ito yung Trichomonas. Yan. Pear-shaped. Plus, hindi siya masyadong halata talaga. If you don't have a really trained eye, yan, you could overlook it. Mukhang cell lang siya. Yan. Yun na yun. So, vaginal hormonal cytology tayo. So, like what I said to you in the first slide pa lang, that your cells are very much impacted or influenced by the presence of your sex hormones, okay? So, it responds to the sex hormones and it has to have a predictable change. Yan. So, alam natin kung ano yung maraming cells pag newborn, pag infant, yan. Pag nagpo-puberty, nagdadalaga, nagme-menstruation na, meron na iba rin yung vaginal epithelium. Pag menopause, iba rin yung vaginal epithelium. Galing, no, guys? So, smears are taken from the upper lateral third. Yan. So, sabi naman sa akin ng friend ko, swab naman daw madalas ang ginagamit. So, ito class, ito, in a high estrogen environment, pag hindi pa nagme-menopause, yan. So, the superficial cells, due to the high estrogen, class is the most abundant. Ang kapal-kapal ng superficial cells, class, pag may estrogen pa sa circulation, okay? And here, sa kanya is intermediate cells and parabasal cells sa dulo. So, normal cells lahat to, okay? However, in cases of low estrogen, pag nag-menopause na, yan. So, konti na lang yung superficial cells. And after menopause, usually mas marami ang parabasal cells compared to your superficial cells. Yan. So yan, pag maraming estrogen class, ang predominant ay superficial cells. Pag progesterone, hindi pa itong progesterone class. This is a hormone for pregnant women. So in pregnancy, konti rin ang superficial cells. Ang marami, intermediate cells. At pag menopause, so decrease ang estrogen, decrease ang progesterone class. Ang effect niya class? Mababa ang superficial, mababa ang intermediate, mataas ang parabasal cells. So menopausal. Ano pa? Pag hindi pa nagpo-puberty class, mataas rin ang, pag there's no puberty yet, so mababa rin, parabasal cells rin ang marami. Or kunyari, 2 weeks old pa lang yung baby. Yan. Parabasal cells ang marami. So class, ito, pre-puberty, ang nipis-nipis pa ng superficial cells, thin vaginal epithelium, thin layer of mucus. Yan, because of low estrogen levels, low pa yung mga bacteria. Okay. However, high microbial diversity pag pre-puberty. So premenopausal, ito yung active na active pa yung estrogen, yung estrogen, yan, makapal ang vaginal epithelium, thick layer of mucus, high estrogen levels, high lactobacillus species. So ang pinakamalaking lactobacillus species ay Lactobacillus acidiphilus. Ayan, mamaya, tingnan natin ang low vaginal pH. Postmenopausal, yan, numinipis na yung vaginal epithelium. Pag, may symptomatic and asymptomatic pala. So, yan. So, guys, so we could now perform, so once we have stained your cells, class, we could now perform cytohormonal maturation index. So what you do is you count 100 cells, then classify them to parabasal, intermediate, and superficial cells. So dapat ang total lahat niya is 100. Yan. So bigyan natin ng example. So in cases wherein there is increased estrogen, the maturation index should be around 0. So 0 ang parabasal. 10, around 10 ang intermediate cells at 90 ang superficial cells. So kung ito yung result, mukhang premenopausal pa, hindi pa nagme-menopause yung babae, mataas pa yung estrogen niya. So kung ang majority ay superficial cells. If the woman is pregnant, the majority is the intermediate cells. Yan. A little bit of parabasal at 0 superficial cells. So, ganun pala, class. So, ang superficial cells talaga, it's highly dependent on estrogen. So, kung walang estrogen during pregnancy, 0 talaga siya. Postmenopausal, so, naku, 110 yung nalagay ko dito. 90 to, guys. 90 and 10. So, postmenopausal, the majority of the cells are parabasal. And infant class, majority is parabasal as well. So, decreased low levels pa ang estrogen at progesterone. We have 20 intermediate cells. So, this could be your guide. So, normal cells tong mga to, ha? So, to superficial cell, intermediate cell. So, it's very apparent through their staining. So, yung superficial cell, mukhang epithelial cells sila pareho. Magkaiba lang yung stain ng cytoplasm. Parabasal, it's polyhedral yung shape nitong dalawa. Itong parabasal, circular, para daw sa any side, up. Yan. So, ito, superficial cells, yan, polygonal, squamous cells, true acidophilia, itong mga red. So, dali hanapin ng superficial cells, diba? Intermediate cells, basophilic, cytoplasm. Actually, itong mga green. Intermediate cells at parabasal, round to oval. Yan, rounder siya. Itong lalaki nitong superficial at intermediate, parabasal, pabilog siya. Pabilog siya, ayun. It has dense basophilic cytoplasm, mas dark. Similar to sunny side up. Eggs found in pre-puberty, menopausal, abortion, and after childbirth. We also have navicular cells, class. So navicular cells are type of intermediate cells. Navicular, parang navy or navigate. So boat shape. So pakitaan ko kayo ng navicular cells. Yan, boat shape siya. Mamukha namang parabasal cell. So ganito, pag sa zoom, na-zoom in. May perinuclear, para siyang may halo. Yan, so those are navicular cells. So, class, kailangan ng practice and training para maka-identify ng cells. So, class, normal cells pa, endometrial cells. So, endometrial, andito, endometrium, andito sa may uterus area. Yan, so parang sunny side up daw rin kasi similar to parabasal. They occur in groups of 3 or more. Found during and after 10 days of menstruation. Hindi ba guys, pag nagme-menstruate, ang nagsaslap off is yung endometrial cell. Yan. Kasi kumakapal nga yung uterus pag nagkaka-menstruation. So pag walang naging implantation, hindi nag-meet yung egg at saka yung sperm. So magsa-slough off siya, ninipis siya in the process of menstruation. So marami ang endometrial cells guys during and after menstruation. We have endocervical cells. So ang cervix dito banda. Okay. So, know your anatomy. So, class, sabi ko nga sa inyo, nalalaman kung saan yung lesion, yung cancer through the type of cell. So, endocervical cells have an honeycomb appearance. Endocervical cells are glandular cells. Hence, it is columnar. Yan. Ano siya? Pa-column, pa-rectangle in shape. And basal cells. So, parang parabasal cells rin. However, it's more basophilic and it's found also parang parabasal on puberty and before puberty and after menopause. However, it has a larger nuclei than parabasal cells. So, tapos na guys. So, ito ang Candida albicans. Yan, di ba? Nakapakita na ako kanina. So, common to sa mga women who are diabetic, who are immunocompromised, o kaya yung mga nagtitake na antibiotic, namamatay na yung mga normal flora, ang nagtatribe na yung mga fungi. So, Trichomonas vaginalis, so pear-shaped, this STD that is from a which is a parasite. So, ang consequence nito, you have a strawberry cervix. So, we also have Gardnerella vaginalis. So, class, normally, ito ang epithelial cells. Ngunit dahil may Gardnerella vaginalis, na-cover ng bacteria yung epithelial cells. Grabe no, guys. Oh. So, now, it's called a clue cell. Yeah. It's a coccobacilli. So, sobrang rami, it has surrounded the epithelial cell. Kawawa naman yung epithelial cell. And here naman, we have coilocytes. So, when a woman class has human papilloma virus or HPV, ganito yung effect sa squamous cell. So, ito yung normal na epithelial or squamous cell. Ito yung nangyayari pag may HPV. So, sabi nila, it becomes atypical. It looks like a wrinkled prune with perinuclear halo. Yan. Due to the entry of HPV, ganito yung itsura niya. We also have Dodderline bacilli or Lactobacillus acidophilus. Yan. So, pag masyadong marami, overgrowth. L. acidophilus yan, Dodderline bacteria. And class, I just want to show you what does an invasive squamous cell carcinoma look like. So, di ba, ganyan lang naman ang itsura ng squamous cell. But however, guys, the nucleus becomes larger when there is cancer. Nagiging, mas malaki na yung nucleus to cytoplasm, increase nuclear cytoplasm ratio. Ganyan yung itsura. So, from this to this. So, ito yung hinahanap ng mga pathologists. Ganyan, no, class? So, yan, magpa-pap smear na. So, guys, this is the end of our discussion. I'll see you again. Bye-bye.